you took your dog to the vet for hip x-rays, and the vet said they showed something called a CCO, also known as a Morgan's line, you may be wondering what that means for your dog. In this video, we'll break down what a CCO line really is, why it forms, and how recognizing it can make a huge difference in your dog's health. CCO stands for caudolateral, curvilinear osteophyte. Caudo means back, lateral, outside. Curvilinear is a curved line, and an osteophyte is a bone spur. So this is an extra line of bone that forms on the back, outside of the top of the thigh bone or the femur. This little line is significant because it's one of the earliest and most reliable warning signs of hip dysplasia and hip osteoarthritis in dogs. In fact, studies found that the CCO line was the first visible change on x-ray in about 3 out of 4 dogs who went on to develop hip arthritis. To understand why this line forms, we need to understand what hip dysplasia really is. So your dog's hip joint, which I have the dog's hip here, is a ball and socket. So the round head of the femur, that's right here, is the ball, and it fits into this cup-shaped part of the pelvis called the acetabulum. When everything fits snugly, your dog can run and play without pain. But in hip dysplasia, the fit isn't quite right. The ball here and the socket here don't line up perfectly. They're too loose. In the beginning, symptoms can be mild, and your dog may not meet the diagnostic criteria for hip dysplasia when evaluated. Unfortunately, this doesn't mean they can't develop it over time. This looseness and laxity allows the ball to slide around too much, sometimes even partially slipping out of the socket. This movement wears down the smooth cartilage that cushions the joint, eventually leading to inflammation, pain, and arthritis. So when there's instability here in the hip joint, every time your dog walks or runs, the head of the femur moves more than it should. When your dog picks up their leg, the muscles that flex the hip, like the iliopsoas that runs under the spine and connects into the top of the femur here, and the quadriceps here on the front of the thigh, work overtime to try to keep this hip stable because there is that excessive movement that's trying to happen in the unstable, lax joint. And so these muscles are trying to work harder to compensate for that laxity. This puts additional stress on the joint because those muscles are producing more force than they should have to. And because the head of the femur here isn't perfectly seated in the joint, that additional force, instead of being spread out across this entire cup here, the acetabulum, that force is going to be spread out over a smaller area of that cup. So there's going to be more force applied to a smaller area, which is going to cause a lot of problems. Then when your dog's paw touches back down on the ground here, muscles like the hamstring group and the glutes up here in the pelvis engage. They pull the leg back, and the head of the femur, if it was not perfectly seated inside the acetabulum, slams back into place in the hip socket here. And this repeated trauma puts the bone under a lot of stress. Your dog's body responds to this trauma by trying to reinforce that area. It adds a little extra bone to make it stronger, and that's the curved line that you see on x-ray, the CCO line. So the CCO line itself isn't the problem. It's evidence that the hip joint has been unstable for a while. If your vet says your dog has a CCO line, it's not a reason to panic, but it is a reason to take early action. The goal of treatment is to stabilize the hip and slow down any damage to the joint. Things that can help include physical therapy and hydrotherapy to strengthen muscles and correct physical imbalances. Massage and acupuncture can improve circulation, loosen overly tight muscles, and manage pain. Supplements can support joint health and reduce inflammation, like fish oil, collagen, undenatured type 2 collagen, turmeric, and many more. And in some cases, surgical options might be recommended by your vet as well. One of the most important things you can do, though, is to keep your dog at a healthy weight. In a 2005 study, they found dogs with a CCO line who ate a regular diet 100% developed osteoarthritis. In dogs that were fed a calorie-restricted diet and were kept leaner, only 55% went on to develop osteoarthritis. So that's cutting the risk almost in half just from weight management. That's really significant. A quick note about puppies. If your dog is under a year old, you may see a similar looking line on their x-rays that's not a CCO line. It's often referred to as a puppy line, and it's probably just a normal growth line that could disappear as they mature. So don't panic if you hear that term, and your vet will be able to know the difference. So remember, the CCO line isn't the disease, it's a symptom of underlying joint instability and issues. Identifying this as an opportunity to change the future and correct problems before they become life-altering. The sooner you can recognize this, the more you can do to keep your dog comfortable, active, and pain-free for many years to come. If you found this helpful, please give a thumbs up and share it with another pet parent who's dealing with hip issues. And if you want to learn more about keeping your dog's joints healthy, I'll have more videos on joints and mobility soon.